Good morning. My name is Mr. Benneth Arinze, and I'm a student of Valdosta State University in Advanced Pathology, Pathophysiology, Dr. O's class. And I'm here to present Connecting Type 2 Diabetics Case Study with Evidence-Based Practice. Type 2 diabetes is a highly prevalent health condition in the United States that affects significant proportion of the country population. The most recent type 2 diabetes national statistics indicate that in 2021, that 8.6 million individuals in the United States were living with type 2 diabetes mellitus and considered 11.6% of the entire population. The prevalence rate of type 2 diabetes vary across different age cohorts, races, and level of education, according to CDC. The percentage of individuals between 18 and 44 years with type 2 diabetes diagnosed or undiagnosed in 2021 accounted for 14.7% of the affected population compared to 18.9% for those between 45 and 60 years and 29.2% for those aged 65 years and older. That's from Center for Disease Control. In relation to age-adjusted type 2 diabetics, data for adult Americans above 18 years of age, the prevalence rates were 13.6 for Hispanic American compared to 12.1% African American and 6.9% non-Hispanic whites. The prevalence rate varies across the level of education attainment, with 13.1% of those with high school education being affected compared to 9.1% of those with high school education and 16.9% with more than high school education. Besides, the prevalence rate also vary depending on the level of poverty, with 13.1% of Americans with less than 100% above the federal poverty line having the condition compared to 5.1% for those within 500% above the federal poverty line, according to CDC 2024. The incidence rates of type 2 diabetics are 1.2 million new cases, or 5.9% per 1,000 Americans above 18 years of age who are diagnosed with the condition based on the 2021 estimates. The incidence rates are higher among individuals between the age 65 years and older compared to those between the age of 18 and 44 years old, according to CDC. Slide 2. Slide 3. I'm in slide 3 right now. Nice, I'm sorry. Type 2, the disease etiology. Type 2 diabetes disease etiology. Type 2 diabetes developed due to insulin resistance characterized by the inability of the muscle and liver cell to respond effectively to insulin signal, requiring them to absorb glucose from the bloodstream and store it in the cell. In this regard, glucose remains in the blood and is not utilized as a source of energy in the body. Besides, the condition also occurs after pancreatic beta cells become impaired over time, thereby resulting in the production of low level of insulin that fails to meet the body insulin demand. There are various genetic and lifestyle factors that influence predispose the individual to the risk of developing type 2 diabetes. In particular, genetic factors predispose an individual to to a risk of developing the condition. Individuals with a family history of type 2 diabetes have a higher risk of developing the condition. Evidence shows that monozygotic twins have a 90% chance of developing type 2 diabetes in their lifetime if one of the twins is living with the condition. Similarly, some members of a particular ethnic or racial group, such as African Americans and Hispanics, also have a higher tendency of developing the condition. Besides, excessive body weight hinders the ability of the body to respond to insulin effectively, while physical activity and poor diet contribute to weight gain that in turn increases the body's resistance to insulin. Poor diet have a lot to do with that. People that eat a lot of starch and all that have a lot to do with getting that. So that's why we have to watch what we eat and be careful. Go if you can talk to your doctor or you can get a dietitian to help you with your diet. That can reduce your risk of developing type 2 diabetics. Lastly, smoking increases insulin resistance, thereby handling individual risk of developing type 2 diabetes. Other factors that contribute to the risk of developing type 2 diabetes ranges from elderly age, especially people above 65 years of age, past history of gestational diabetic, women that get diabetic during their pregnancy, and having a hypertension condition. Pathophysiology of type 2 diabetes. Type 2 diabetes is a metabolic disorder that develops due to insulin resistance and a reduction in insulin secretion caused by the impairment of beta cell. In particular, the insulin resistance is caused by the disruption of different cellular pathways, thereby leading to reduced response or sensitivity of cell ability to absorb glucose in the blood, especially those in the muscle, livers, or adipose tissue. A reduction in the cell sensitivity to the insulin makes the beta cells secrete more insulin in order to prevent hyperglycemia. However, the increased secretion of the insulin does not adequately compensate for the declining insulin sensitivity, and a hyperglycemic condition develops. This condition is exacerbated by the tendency of beta cells to become impaired, thereby resulting in insulin deficiency. Insulin resistance coupled with reduced insulin secretion leads to development of type 2 diabetes. Clinical manifestations / symptoms of type 2 diabetes. Type 2 diabetes is characterized by different symptoms, but they tend to vary depending on the severity of the condition. Besides, they also tend to develop slowly, and they are noticed over time as the condition progresses. Some of the common symptoms of type 2 diabetes are polydysplasia, which is associated with the tendency of excessive glucose in the bloodstream to draw much more water from the cells, thereby leading to the dehydration. This aspect makes an individual experience increased thirst. They want to drink all the time, water. The second symptom is polyuria, caused by the tendency of the kidney to eliminate excessive glucose, leading to frequent urination, especially at night. Keep getting up and peeing at night. If you have that condition, if you haven't been diagnosed and you have frequent tests or frequent urination, you need to see the doctor to check you out to make sure you don't have type 2 diabetes. Or increased hunger, always hungry. That tends to make that's one of the signs and symptoms of type 2 diabetics too. Also, type 2 diabetes is associated or occurred due to the cell inability to adequately manage glucose from the bloodstream due to insulin resistance. The tendency to feel fatigue occurs too. If you frequent fatigue occurs because the body cells are unable to absorb enough glucose needed to produce it, because glucose gives energy, helps with energy, thereby making an individual to feel fatigue all the time, frequent time. You're always tired. You don't feel like getting up and doing anything. That's part of signs and symptoms of diabetics. Blood vision, not seeing very well, occur due to the tendency of the fluid from the eye and lenses to be pulled out due to high blood sugar, thereby making it hard for one to focus, as an aspect of the causes of blood vision. Gradual healing of wound. When people with type 2 diabetics, you see them a lot, people that have neuropathy and all that in the leg, they don't feel the pain and they have injuries. It takes so long to heal due to impairment of the blood circulation and immune system by high level of sugar in the blood. Other symptoms from the ranges from unexplained weight loss, dark patches in some particular areas of your body, and the tendency to have tingling or numbness feeling to your hands and your feet. Type 2 diabetes diagnostic test, on slide 6. Several tests are used in diagnosing type 2 diabetes. One of the tests is a fasting blood sugar test that is usually conducted 8 hours after fasting. An individual is considered to be diabetic free if the level is less than 100 mg/dl. Pre-diabetic if their level is 100 to 125, and diabetic if the sugar level is 126 and above. The other diagnostic test is an oral glucose tolerance test characterized by testing blood sugar after fasting overnight and 2 hours following consumption of sugary drink or anything that is high in sugar. An individual is considered diabetic free if the sugar level is 140 mg/dl after 2 hours. 140 to 199 if one is pre-diabetic, and 200 and above if one is a diabetic. Another test is A1C test, which helps in measuring the average percentage of sugar, average percentage of hemoglobin coated with glucose sugar level for a period of 2 to 3 months. An individual is not required to fast in this case. An individual is considered to be normal or diabetic free if the percentage of the hemoglobin is less than 5.7. Pre-diabetic 5.7 to 6.4, and diabetic if is 6.5 or higher. That's for A1C. So if your A1C is 6.5 or higher, then you are considered a diabetic. The other diagnostic test is a random blood sugar test that is used in testing diabetic irrespective of the time 118. A person with a blood sugar level of 200 mg/dl or higher is considered to be a diabetic. Risk factors for type 2 diabetics. Type 2 diabetics is characterized by different risk factors. One of the risks is age, and an advancement in age heightens the risk of developing type 2 diabetes. Beside ethnicity or being a member of a particular or racial group, such as Native American or African American, this group have a higher rate or chances of developing type 2 diabetics. Having excessive weight or being obese, being physically inactive, or having a poor diet that contributes to gaining excessive weight also increases the risk of developing type 2 diabetic. Additionally, individuals with a history of type 2 diabetic have a high risk of developing the condition. Smoking, chronic stress, and sleep disorders also increases the risk of developing type 2 diabetes. People from socio-economical disadvantage that can manage themselves, that can barely eat, they can get their medication, they can do a lot of, have money, poor people basically, have a high risk of developing the condition because they don't have, money or to get their medication or don't know resources and all that. Medical factors such as pre-diabetics, gestational diabetes, women with pregnancy, that have diabetes due to their pregnancy, blood pressure, high cholesterol level also increases the risk of developing type 2 diabetics. Treatment and management. Type 2 diabetics is treated and managed using different ways, such as using the medication such as metformin that helps in reducing the glucose level, and insulin, which focuses in stimulating the pancreas to secrete more insulin, and insulin therapy that and the insulin too, you inject them to control blood sugar level. The condition is also managed by the lifestyle changes of taking a balanced diet. You can manage diabetics by taking a balanced diet, engaging in a regular physical exercise, working out at least 30 minutes to an hour, at least 2 to 3 times a week, can also help. Managing your weight, losing weight. I know some people use Ozempic that manages both the blood sugar and the craving of food. Like they give it once a week. Some people get it once a month, depending. They have all kind of new other medication that help you with the weight gain and control your blood sugar. That you don't have to get insulin every day. They can help you to. You can do it maybe once a week, once a month, and they can still help you manage both weight and everything. Ceasing in smoking and managing stress also help, with reducing the risk of type 2 diabetics. Beside the condition, is also managed via, you can manage type 2 diabetes via regular monitoring of your blood sugar, to control the level. So, some people, they give them regular insulin. When it's too high, the regular insulin can bring it right down. They call it fast acting. Then they can have like 70-30 or Lantus, maybe Lantus, which is long acting. They usually get in the evening and all that. Health education and support of patients by impacting evidence-based knowledge on different aspects, such as diet, engaging in physical exercise, compliance with regular medication, and regular monitoring of your blood sugar level will helps a lot. It's very, very important. Type 2 diabetic prognosis. Type 2 diagnostic prognosis vary widely depending on numerous factors, such as the age of the patient when the condition is diagnosed, level of physical intensity, diet taking, weight control, and compliance with prescribed medicine. In particular, better management of blood sugar level coupled with effective weight management and engagement in recommended physical exercise intensity helps improve the prognosis a lot. That's very important. Besides adherence to the medication prescribed and routine monitoring of blood sugar, improves healthcare outcome and mitigates the risk of complication. Genetic factors and existence of comorbidities worsens healthcare outcomes. I have a thick accent. Individuals diagnosed with type 2 diabetes at age 50 have a lifetime expectancy of 6 years shorter compared to those without the condition, which means people that are at the age of 50 with diabetes live 6 years lesser than people without the condition at the same age. One study showed that meeting 2 treatment goals, such as effective management of your blood sugar and weight control and your blood pressure, help increase life expectancy by 3 years on average for individuals living with type 2 diabetes. So managing it very well can increase their lifestyle, can increase their lifespan by at least 3 years. Poor management of type 2 diabetes heightens the risk of developing complications such as cardiovascular condition, as well as eye complications, retinopathy, kidney damage, nephropathy, and nerve damage, neuropathy. Social cultural impacts and burden of type 2 diabetes in the United States. Type 2 diabetes is characterized by serious socio-economic impact or implications. According to American Diabetes Association 2024, the total economic cost of diagnosis of type 2 diabetes in 2022 in the United States are projected to be $412.9 billion US dollars. 306.6 billion was incurred for indirect medical costs, while $106.3 billion was associated with indirect costs, according to American Diabetes Association 2024. Besides, the economic study also demonstrated that people living with type 2 diabetics incurred medical costs that were 2.6% times 2.6 times higher compared to people without the condition on average after adjusting age and sex differences. Excuse me. The major components of the indirect costs are 28.3 billion associated with the reduced employment due to disability caused by type 2 diabetics, and $32.4 billion characterized by loss of productivity due to 338,526 premature deaths caused by type 2 diabetics. The inflation-adjusted direct medical costs increased by 7% compared to 2017 statistics and 35% compared to 2012 calculation. Congruence and incongruence between literature and client's case study in relation to type 2 diabetes treatment. We have a case study that involves a young African-American woman aged 18 years old living with type 2 diabetes. She has a family history of type 2 diabetes and she is obese with a BMI of 32. Due to her physical condition, she has been unable to engage in any form of physical exercise and she is bedridden also. She has been refusing to take medication on a regular basis based on a prescription and take her prescription based due to the side effects, and she was recently diagnosed with high blood pressure, hypertension also, which put her even in a higher risk of of developing type 2 diabetes. This aspect is in line with the evidence-based findings that show that poor management of type 2 diabetes heightens the risk of developing cardiovascular. See, because she wasn't taking care of her diabetes, now she's developing hypertension, and next probably we're gonna follow is a high cholesterol, which will heighten her risk for cardiovascular disease. Congruence and incongruence between the literature and client case study in relation to diagnostic. The client was, predisposed to higher risk of developing type 2 due to her weight, racial group, and family history. These are some of the major factors that could have greatly influenced the high risk of developing the disease, type 2 diabetes. Existing literature shows that family history, being a member of an African American group, and being obese or overweight are major risk for type 2 diabetes. The diagnostic tests were based on the standard test and procedure. Impact on the future practices. There is a need to integrate evidence-based care for patients living with type 2 diabetes in order to improve healthcare outcomes. Besides, it is also highly important to tailor standard care to individual patient needs by considering one's background, preferences, and needs in order to improve healthcare outcome. Offering customized care supported with evidence-based practice will influence the patient to accept the treatment modalities recommended. Besides empowering patients through counseling and offering self-care health education, enable patients to make health-conscious decisions that contribute to a better healthcare. Thank you, class, for staying and for listening to my presentation. And you all have a wonderful day. Thank you.